Bismillahirrahmanirrahim. Welcome to another Tabadlab Policy Roundtable. It's my great pleasure to be back and to welcome everyone, and to welcome also a fantastic panel to talk about what is increasingly becoming one of the most important issues globally in terms of public policy, which is the reopening of schools. As viewers will know, there's been a substantial crisis, a crisis of learning, a crisis of revenue and profitability, a crisis of teachers, and a crisis of safety and well-being as far as the mass closure of schools all around the world is concerned. Tabadlab has produced today and published a deck which explains and explores both the school closures and the incentives and the pushes that are causing an interest and really a momentum towards school reopenings all around the world, and particularly in Pakistan. The NCOC is yet to decide, but it seems increasingly clear that September 15th will be the date that will be announced as the reopening of schools all around the country. Provinces have already begun to put together standard operating procedures to make sure that the risks are mitigated. And the panel that we've assembled today, and we're very grateful to each one of them for making time to be with us today, is really, we're going to try to discuss various aspects of school reopenings. We're really lucky to be joined today by Dr. Ayesha Razzaque, who is a education scholar. You read her weekly column in the news. She is the most consistent education thought leader as far as publication is concerned. Perhaps the only person, at least for me, partly because he's one of my teachers and I've known him for over 2 decades, that exceeds in any way Ayesha's output and work is Dr. Faisal Bari. Of course, Dr. Bari is a professor at LUMS and a foremost thought leader, not just in education, but in wider issues of microeconomics and how it affects ordinary people. We're really lucky to be joined by Mehnaz Akbar Aziz, who is an M&A for the Pakistan Muslim League Noon, but more importantly, I think, has been a very consistent advocate for children and for education for over 2 decades. And we're also really lucky to be joined by Aurangzeb Badini, who is the Deputy Commissioner in Quetta, a very accomplished civil servant and one of the bright stars of the Pakistan Administrative Service. Badini Saab is currently completing his PhD whilst he helps lead Balochistan's response to COVID-19. We're also going to be joined by Nadya Karim Shah, who is, of course, a stalwart education specialist and has worked on a number of initiatives. Most recently, she's the coordinator for the Let Girls Learn and the GPE effort in Pakistan. And so we're really, I'm very pleased that all of you are with us. The format of this conversation, as you know, is that we like to get everyone to have at least one chance to lay out their position on the core issue. And I thought maybe today we'd get started with Dr. Ayesha Razzaque. Dr. Saiba, you've also written about this, and when we spoke, you said you're not entirely against school reopening. So why don't we begin, if you don't mind, with you, and explain to us what your view is on school reopenings.
This is the wrong article, Musharraf. This is not going to. So a lot of people are not going to be very happy about opening this conversation with this particular piece. But
that's fine. We've talked about curriculum before. We'll do it again. But today we're going to stick to school reopenings.
Sure. So, Musharraf, let me start by saying this. I think again, this is something to which black and white yes or no. It's not possible to give that answer, right? So there are multiple indicators that one has to look at, and let me just give you a very an overview of what those different indicators look like, and how where we are at in terms of all those different indicators that will allow us to then say if we are going to be able to safely open schools or not. So the very first factor, which is which is relatively speaking more straightforward, is the positivity rate. So we know world over the school systems that are opening at the moment are considering either WHO's guideline, which is basically if fewer than 5% of your population tests positively in a 2-week span of time, then it's safe to assume that you can start considering reopening. Then a lot of people, a lot of different sources are also quoting numbers from or criteria from the Harvard Global Health Initiative, which basically suggests that if you have fewer than 25 people out of a population of 100,000, then it's safe to start considering reopening. So if you go by that criteria, and if you look at the national average for Pakistan right now in terms of positivity rates, I think it stands somewhere, if the last figure that I saw still stands, is at 5% or a little less than 5%. We'll have to see how that changes, if at all, given that August 14 was just a few days ago, and we know what the roads looked like or what the SOP adherence looked like that evening. We also know that Muharram is up ahead, so numbers may fluctuate, which is why the NCOC and the federal body has said that they are going to sit again on the issue, and on September 7th and decide whether September 15th still looks feasible for school reopening. So this is rather straightforward, but we also know from other countries' examples that even countries that started reopening, and by the way, were much better prepared than us, not just in terms of, the fact that they are more developed school systems, but also because of the fact that the scale of the problem that we're looking at is just so much, so different from one country to another. So a lot of these economies or a lot of these school systems that started reopening are much smaller in scale than what our scale is. In terms of the number of schools that they have to deal with, the number of children that they have to deal with. They also have more funds to be able to tackle a problem at that scale. But even those countries did not go in, all at once. So what that means is that we know, and I'm not going to belabor that too much because we have been hearing a lot about it, and we'll probably discuss this in greater detail as the conversation proceeds. But where they started reopening in a staggered fashion, in a phased manner. So in what that means is that not all districts, for example, opened. Some districts opened. Even where districts opened, not all schools opened. Schools opened based on how big they are, how much space they have, how much funding they have to adhere to SOPs, etc., etc. Now, if you look at the positivity rate for Pakistan, it may be easy to say that yes, considering if they stay at pretty much the same place, then we'll be safe to reopen. But then, do we have the capacity to ensure that we're ready for the step that comes after reopening? That is adhering to the SOPs. Like I said, the scale is just huge. And I would like to, if I still have some time, I just want to say these crude figures at the national level because different kinds of people are listening to us right now, and maybe not all of them are aware of the scale that we're dealing with. And I like to say the unit in Urdu because I just feel like the sense of seriousness that comes with saying crore is much more than that comes with when you say tens of millions. So right now what you're dealing with at the national level is that you have at least somewhere around 3.25 lakh schools. You have over 5 crore bache only at the school level. You have around 2 million, 20 lakh teachers that you have to deal with. Considering that you have 2 lakh schools, that is the number of, also the number of head teachers or school heads at the minimum that you have to deal with. Then there's a lot of, there are at least 2 million, if not more, non-academic staff that you're going to be dealing with. On top of that, you have your district education hierarchy. I'm talking about the public school system and how it's structured at the moment. Although the figures that I've quoted also include, both your public and your private sector schools. So this is the scale that you're dealing with. Now, this is your demand side. Are you prepared enough to cater to this demand side? For that, you have to look at the supply side, right? So look at, do we have the kind of funds that we need to tackle a problem, this problem at this scale? For that, what are the different sources of fundings that you can, possibly look at? One is your regular ADP. Jo har saal, the governments, provincial governments release their ADP schemes. That these are the different things that they're going to do in education, for example, this year. Last year, of course, ADP was developed before COVID happened. So, of course, there's no provision in that ADP. When you look at this year's ADP, I know at least the ADP portfolio of at least one province, because I've actually worked on it. There's no provision for anything of that nature, even though those ADP schemes were developed after COVID closures had already happened. The other big source of funding that you can be looking at is your donor side, right? Just the other day, I was reading an analysis that was done by the UNICEF that looked at, what the demand side, the gap in the funding required at the demand side, and what we are possibly going to be able to provide. The gap there is huge. I mean, yes, the donor funding based on, what their priorities are, what geographical areas or what categories of schools are their priority, they're going to be able to make a difference, but they're not going to make a dent into the problem. The third thing that I was actually, counting on is the recovery strategy that each province has come up with. So we know that Punjab, through their Rise Punjab strategy, announced 3 months ago, the first version. They did they basically published their economic recovery strategy, also included their education recovery strategy. There's no reflection of this issue in that strategy, because we all know how strategies are formulated. KP just very recently released its strategy. But I'll, credit where it's due. At least there's some reflection of the fact that this is going to be a problem when schools open. We'll need to provide sanitation. We'll need to provide, provide masks and, other kinds of facilities that make sure that opening is safe. There's some reflection of that. But then again, the proof is in the pudding, right? So having a plan is one thing, and having a good plan is, of course, something that should happen. But what the implementation is going to look like, that will tell you, whether we're ready or not. Just a little anecdote, and there I'll finish my my very long 10 minutes. I was talking to a couple of DEOs just the other day. I'm not going to mention the province, but when you talk to a couple of DEOs, it's pretty much, it's very safe to suggest that it's pretty much the case across the province, because we know that when directions come or when decisions happen, they are notified to the district officers at the same time. So I just called him up and asked him, how they're doing in terms of school reopenings, are there any directives from the provincial level, and this whole conversation at the federal level about taking, local input. How true or close to reality is that? And what I learned from him, and also from a couple of district tours that I've done very recently, and in my conversations from head teachers, is that nobody at the local level knows what's happening. They have absolutely no clue. They have not been, brought into the fold. No one has asked them to come up with any local plan of any. We're already late for that. If we are to open in September, we're already late for that. Nobody knows if they are to run enrollment campaigns differently this time around. Nobody knows if they're going to be, if they're going to have enough funds to be able to, implement all these SOPs that the government keeps talking about. Nobody has any academic recovery plan. Nobody knows that there's going to have to remediate learning losses. They're going to have to accelerate learning. There's nothing of that sort that the local level is aware of. So I guess what I've tried to tell you from this comment is that it's a problem at a very big scale. it's a problem that's not homogeneous. It's going to look very different from one place to another, from one kind of school to another, etc., etc. And are there any tangible? Is there any tangible evidence that we have right now that gives us some confidence that we're actually ready to reopen in September? I would have to say no.
Okay, I think that's a great place to start for a number of reasons, and one is that I think it's really important to be very clear-headed on the issue of COVID-19 because it involves a disease to which there's no known solution, and in some cases, this disease has the capacity to be fatal. So, I think those warning sort of notes are well received. I do suspect that Aurangzeb Badini, who is the DC over in Quetta and is operating both at the local and at the provincial level, provincial by virtue of being in the capital city, that he might have a different perspective in terms of the degree to which people do have some plans for the local level. But before I come to you, Aurangzeb, I thought maybe if it was okay with everyone, I would go to no, that's not where I was going to go, producer Saab. I was going to ask Mehnaz Akbar Aziz to. So we're having some technical difficulties. Viewers will note that this is Tabadlab Policy Roundtable 13, and we've already had some substantial technical challenges, which are going to be a fun conversation. But just picking up from where Dr. Razzaque left off, Mehnaz, could I ask you, you've just recently published an article in the news, the same paper that Ayesha writes for and that I also write for, in which kind of you laid out a case that's broadly similar. One thing that I was struck by in your presentation was the issue of finances. And since that's something that we've also dealt with in our deck, I thought maybe I'd ask you to talk a little bit about what your fears are and the degree to which you think we are either prepared or not.
Thank you, Musharraf. Bismillah Rahman Rahim, and it's great to meet up with friends. So, yes, first of all, I'd like to talk a little bit about budget 2020-2021. And when the budget came in and we were analyzing the budget in the assembly, it was quite shocking and surprising that it didn't seem that the budget was dealing with the pandemic in Pakistan. And of course, it touches on various areas, especially health and education. So education and health it didn't seem from the budget that we are such a huge country, and we are suffering from this pandemic, and we have not been able to, the government has not been able to deal with this pandemic. फिर दूसरी चीज मैं आपको बताना चाहूंगी. अच्छा, then I would come to education, but talking about corona, we didn't do much analysis, disaggregated analysis on children. 0 to 16 or 18 years of age, how many were affected. I remember that I looked up the numbers for Islamabad, which is, a smaller unit, not that small, but still a relatively smaller unit and more organized because of its district administration and the health, including the health personnel of the district administration. So around the middle of April, 2,500 children were affected. 11,000 adults थे और उसमें 2,500 children थे. So if you look back and you look at all the numbers that we have been quoting and all the numbers that we have been advocating, we have hardly talked about children, and we have hardly talked about girls and boys and men and women. It's just been a figure कि कोरोना के कितने बंदे हैं, कोरोना के कितने बंदे मर गए हैं. अभी recently in the United States, they have given a number of 97,000 मतलब तकरीबन 1 लाख बच्चा जो कि फ्रॉम द स्कूल्स हैव बीन इफेक्टेड. मुशर्रफ, करेक्ट मी इफ आई एम रॉन्ग, बट दिस इज व्हाट आई रेड. तो ये है कि दैट्स अ वेरी लार्ज नंबर. तो पाकिस्तान में हमने तो अभी तक एनालिसिस किया ही नहीं. And when we don't do an analysis, and when we don't talk about it in the media, and when we don't talk about it with the parents, so it seems that there is no corona. And even the Prime Minister in one of his speeches said कि ये तो older and बीमार लोगों की बीमारी है. उनको इफेक्ट करता है, फ्लू लाइक सिम्टम्स होते हैं, बाकी जो जरा ज्यादा उम्र के लोग होते हैं तो वो मर जाते हैं. सो ये dealing with children and corona, we have given very mixed signals. Coming to specific budgets for schools, I talked to the Federal Directorate of Education in Islamabad as I was doing the budget analysis, and I was going to do a budget speech in the National Assembly. And I was told that, their development budget for this year have been cut. Overall, वो जो एक्स्ट्रा होते हैं फाइनेंसेस जिसमें से वो कभी सफेदी करा लेते, नॉट डेवलपमेंट बट द एक्स्ट्रा, द रिकरेंट डेवलपमेंट बजट्स आल्सो हैव बीन कट, एंड द रिकरेंट बजट्स विच इज के कोई सफेदी करा ली, कोई खिड़की टूट गई वो कर ली ठीक, कोई छत टपकी वो ठीक करा ली, और उसको वो इस साल कोरोना के प्रिवेंटिव मेजर्स में आईपीईज में जो है वो खर्च कर सकते थे. सो देयर इज नन ऑफ दैट. सो देयर इज नो कोरोना फंड फॉर द स्कूल्स. तो आप मुझे बताएं कि हैंड सैनिटाइजर्स, मास्क, फ्यूमिगेशंस, पानी पीने के नल के हैंड वॉशिंग, ये कहाँ से होगा? टीचर्स कहाँ से करेंगे? एंड देन यू नीड टू बी टेस्टिंग. इस वक्त पाकिस्तान में वी आर कमिंग इन टू अ फेज. I was talking to Dr. Fahim at NIH yesterday about the situation now, and he said that a large number of people in Pakistan are now coming up as asymptomatic on corona. मतलब कोई symptoms ही नहीं है. So they are carriers, and they can affect in a very adverse way. To जरूरी नहीं है कि जिस बंदे को आगे लगे वो भी asymptomatic हो. So from that, are we ready to test? अगर हम गवर्नमेंट को ये एबिलिटी देते हैं, अगर हम ये गवर्नमेंट को ये अपॉर्चुनिटी देते हैं, गवर्नमेंट स्कूल्स को, कि गवर्नमेंट उनको टेस्ट करेगी, तो हम प्राइवेट सेक्टर स्कूल्स को तो ओन नहीं कर रहे. Ayesha talked about the numbers. I had exactly the same numbers on schools. And इसमें ये है कि तकरीबन 50 लाख बच्चा पाकिस्तान में प्राइवेट स्कूल्स में जाता है, out of which 10% are the elite private schools, and the rest are the low-cost private schools, which are service providers for the government of Pakistan because they are working on increasing the literacy. उनके लिए आपके पास क्या पैकेज है? कोई पैकेज नहीं. Nothing has been worked out. So ये है कि ये situation बहुत बड़ा disaster है. Now, yesterday Murad Said said, the minister for education in Punjab, Murad Ras, yes. Thank you for correcting me.
Because you're in the National Assembly, I think it's easy to have Murad Said on your mind. But
Murad Ras, yes. So there were many private sector schools open, and Dr. Bari can talk about that, open in Punjab yesterday, and they said कि जी मुझे तो कोई स्कूल नहीं नजर आ रहा, मुझे बताएं कहाँ से है कोई वो स्कूल. तो ये कल कुछ लोगों ने खोल दिए, फिर 15 अगस्त में सवात में खोले गए स्कूल्स, प्राइवेट स्कूल्स, उनको सील किया गया. तो ये 15 सितंबर की बात हो रही है. आज मैं एक एलीट रूट स्कूल की प्रिंसिपल से बात करी थी, तो उन्होंने कहा हमारे तो 15 सितंबर है. एंड व्हेन आई सेड कि आप प्रिपेयर्ड हैं, नाउ दिस इज एन एलीट स्कूल OA लेवल्स का, सो शी सेड नो वी आर नॉट प्रिपेयर्ड. सो द थिंग इज दिस. अच्छा, मैं इसके बाद एक बहुत इंपॉर्टेंट, पहली बात तो ये कि फाइनेंसेस बिल्कुल नहीं है, बिल्कुल भी नहीं है. सो जो एलीट प्राइवेट स्कूल्स है वो क्या करेंगे? जब धमाके होना शुरू हुए तालिबान के, तो उन्होंने क्या किया? सिक्योरिटी गार्ड्स रखे, बार्ब्ड वायर्स बनाई, सब कुछ उन्होंने पेरेंट्स से पैसे ले लिए. अब वो ये करेंगे, एलीट वाले स्कूल जो है ना, ये सारे कोरोना फंड जो है वो पेरेंट्स से ले लेंगे. अच्छा, उसके बाद लो कॉस्ट प्राइवेट स्कूल्स मारे जाएंगे, और एंड हाउ विल वी डू द गवर्नमेंट स्कूल्स? हाउ आर वी गोइंग टू डू द गवर्नमेंट स्कूल्स? उसके बाद मैं आती हूँ द कंफ्यूजिंग स्टेटमेंट्स. नाउ इफ यू आर टॉकिंग अबाउट 15 सितंबर, come 15 September, which is not very far away, what are we going to do about it? So this decision has to be a black and white decision. It can't be Ayesha, from the way Pakistan is being run, मतलब हम ये नहीं कह सकते कि सिंध के फलाने डिस्ट्रिक्ट में ये खुल रहे हैं स्कूल, दूसरे स्कूल में, मतलब इतना अजीब कंफ्यूजन और सारा कुछ हो जाएगा. वी हैव टू टेक, और अभी देखें कोई टेस्टिंग नहीं हो रही, हमें नहीं पता कि कौन से हाई पॉइंट्स है कोरोना के, हमें बिल्कुल नहीं पता इस्लामाबाद में क्या हो रहा है, लाहौर में क्या हो रहा है, गुजरांवाले में क्या हो रहा है, सिंध में, सखर में क्या हो रहा है, वी डोंट नो. खैबर पख्तूनख्वा का तो बिल्कुल भी नहीं, बलूचिस्तान का भी बिल्कुल भी नहीं. So the thing is this, that we have to decide that फिर उसके बाद आगे जब जाते हैं तो आ जाता है हमारा दिसंबर, मतलब जो पहली.
Before we get to December, Mehnaz, I wondered if I could jump in because we've had two interventions now, both yours and Ayesha's, where there's a lot of skepticism, especially on the corona thing, and just given that there's nobody that is in government. At least in a political position. Of course, Aurangzeb is a government official, but he can only fairly, I think, speak about Quetta and Balochistan. Maybe I could say a couple of things on whether, on the state of the disease. All the data that we have, and so Tabadlab has been tracking the virus now quite robustly for mostly since the beginning, but we've had a data portal where we're looking at the trends, and it's very, very unlikely that the trends that we're seeing are fake. So there is definitely some sort of a plateauing and a drop off in the infectiousness of the disease. Now, that doesn't mean that it can't come back. It doesn't mean that new strains aren't possible. But as far as the core, so-called peak, we are past the peak based on all the data that we have. The testing numbers are actually, if you look at the per million testing and the per million response rate in terms of positive results for the tests, those numbers have also been falling. So even if you account for less testing in absolute terms, there's actually been more testing per positive case. And despite that, the numbers are coming down. If you take that, then I don't think it's entirely fair to say that we don't know what the state of the disease is. And one of the arguments that we've made in our deck, it's not really an argument, it's almost an admission, is that the schools are going to reopen principally for two big reasons. One is that the learning loss, the quantum of the learning loss is too large to ignore and to continue. And I think Dr. Razzaque pointed at that. Now, whether or not there's enough that'll be done to address that is obviously a secondary or a separate conversation. The other big issue, and Mehnaz, I want you to respond to this in particular before we go to Dr. Faisal Bari. The other big one is low-cost private schools, because, as you mentioned, there is a massive bankruptcies crisis there. They have really suffered. Now, what I feel about them or think about them, whether low-cost private schools are the solution for the education crisis in Pakistan, all of those questions notwithstanding, there is an enormous number of children that attend low-cost private schools, and so the pressure from there is also quite high. So if you take those two things, I don't know if we can argue legitimately that we shouldn't open schools. And I guess what I'm hearing from you is that we're not prepared to open schools. So how do we cover the difference there?
Between which difference are you talking about? Sorry.
I'm looking for some sort of a arbitrage, right? We want to be able to open schools, and we know that there are risks, and we also know there's limited funds. Given all of that, what is the best way forward? Surely we can't say कि school ना खोले. So if we are going to open school, what's the best way forward?
So the best way forward would be, in my opinion, if would be to not open primary schools. The earlier grades, not open those, because those children are very vulnerable. And considering that most of our children are malnutrition as well, both in public as well as private, so unki immunity bahut low hai. So if you have to open, and we are looking at learning losses of all age groups, but particularly jo board exams hote hain, parents are very concerned, children are very concerned. So open from 6th grade upward. Not the pre-primary का जो मैं दिसंबर की आपको बात करी थी, वो ये कि go past the first winter of corona. go past that, because otherwise it could be, a massive. Another thing that I wanted to say here is that, when 15th of September, when we come to the point of 15th of September, let's say the government decides whether they're going to open the schools. So all the online business is going to come to a halt. There would be a lot of parents who will decide on their own that they're not sending their children to school. So they're at a loss also. So ये हमने अभी नहीं सोचा कि parents may, the government may decide that open schools, parents may decide they will not send the kids to schools. तो फिर क्या होता है, वो उस लर्निंग लॉस को हम किस तरीके से कवर करेंगे? फैसल बारी साहब इस पे मेरे से ज़्यादा बेहतर समझते हैं, वो ज़्यादा बेहतर बता सकेंगे. So all of these considerations, and I think that we need to go back to the drawing. I'm also on the Education Standing Committee, or Parliamentary Education Standing Committee. We need to go back to the drawing board and talk about this with the policymakers, that you have to be looking at all sides and taking cognizance of low-cost private schools, of all the schools, and parents as well, because parents have a lot of considerations as well. So it's not we.
So we'll come back to that issue. I just want to make sure we get everybody involved in the conversation. Dr. Bari, one of the sort of really memorable conversations I've had with you is the one on transportation, and I feel like it makes sense for us to maybe try to look at the transmission risk. What we did was we looked at sorry, I was going to try and share a screen, which I'll ask my colleagues to do. But basically, students, schools, teachers, transportation, staff, and the actual school itself. When you look at the exposure level, maybe one of the most high exposure things that any citizen or individual can do is go to school. So maybe starting with that, just your reflections on school reopening writ large, but specifically on the nature of exposure, especially for kids and for teachers.
Thank you, Michelle. Let me just say 2-3 things. एक तो ये कि I think I've at least seen one country that I heard about where they're thinking of writing off the entire academic year. Now imagine a situation like that. I mean, in the extreme, are we willing to consider something like that? We say, okay, the entire academic year is written off. We'll come back next March or April or whenever is possible and start again from wherever we left off. In that sense, there's no learning loss. In the sense, I mean, when children will forget, so we'll have to go back and teach them some of the things that they forget. But there is no year skipping, there's no SLO skipping. And what you'll have, though, is 1 year lost for children. Now, is that significant enough? If you remember, there was a time when BA, MA examinations or even medical and engineering examinations used to be, the course was 4 years, but they used to take 6-7 years. Sometimes it used to be 3-4 years behind. People would always be crying that how much time is lost, etc. But it was, I mean, this is a special circumstances. So I'm just saying that it's even that is not impossible. 1 year in the life of a nation, of a generation, of a people, it's a loss. But it is if the question is life or that, then obviously we're not going to risk the life of an entire generation and expose them, etc. So that's a calculation. Now, but it does impose fairly heavy cost on everyone, including businesses, etc. If you're asking private sector to close for a year, that will destroy them completely. It will be hard for government to keep even government schools closed for a year, etc. So then the ultimate thing is that either we open up in September or so as the numbers are coming down, or after the winter, January. But and that choice, the two seasons, the trade-off is the winter season, and if we expect a coming back of the virus because of the cold, etc. Now, there doesn't seem to be a lot of evidence that obviously of that yet of the virus being linked to the cold, so we'll have to see how we deal with that risk. Now, Coming to the issue of my own feeling, Mehnaz and Ayesha are right in saying that the dangers are very serious, very grave. It is very hard to think of whether we are ready or not, because clearly we are not. SOPs, if the SOPs are comprehensive, they become too complex for us to implement or to monitor even. If they are too easy and simple, then the problem is they might not be enough. Every country that is going for opening schools and universities has very, very high levels of testing that they're bringing in. I was talking to the dean of dean outside in the US, and they were saying that they're opening with lesser numbers, they're opening with far more precautions, but they're also going to test every student that is on campus twice a week, it seems. Now, we can't have that kind of testing for money reasons, for many other reasons. Our testing capacity is not that much either. So short of testing, then we rely on SOPs. But SOP implementation, we have seen again and again, is not easy for us. So what then seems to be almost inevitable is saying that if we are going to open, we are going to take a fairly large risk. A risk of exposing not only children, obviously, but also families and homes. And there will be outbreaks in various places. Now, how do you manage those outbreaks? Do we have enough to do that with all of the smart lockdowns, mini lockdowns, whatever the terminology is being used now? Do we have the capacity to do that? I think an essential item there is how much confidence do we have in being able to decentralize the system and allow district, sub-district, and even AEO and principals to do a lot of things that are at the local level, that make sense at the local level. Do we have that confidence in them? Do we have the ability to have that kind of decentralization where the schools can, depending on a lot of other things at the local level, how much land do they have? Can they have classes in the open or not? Can they ask students to come one day and not the next day? How do we divide classes? Is it an overcrowded school or not? A lot of public schools have fairly large grounds. Can we use them effectively, though the weather is still in most of Pakistan fairly extreme, but by September, can we use them more effectively? Private schools will have a very different dynamic. A lot of them are in very small, cramped housing, etc. They might not be able to do that kind of distancing, etc. And so the protocols will have to be very different. And our ability to monitor is almost non-existent compared to public schools. Public schools now are much more monitored by the state, obviously, than the private schools are. That's the way it should be, but that's just a fact that then you can't monitor what the private schools will be able to do or not. How do you then do the testing and then isolation and so on in private schools? So the problems are going to be very large, but the question I think the basic question we have to go back to is, how much of a learning, academic loss and loss of business, both are tied with private sector, which is very large, as Mehnaz and Ayesha have also said. How much of a loss are you willing to take? And that willingness is not just mine. It's not just the state. It is the many hundreds of thousands of people who are involved, whose employment is there as teachers, as principals, and as obviously business owners and so on. So how much of that can you take? If you think that the cost is already getting too much, and that's the sense I have from the dialogue right now in the newspapers and so on, that both people in government and the principals and owners, etc., and especially private associations, as Mehnaz was saying, they're already pushing for opening. They already think that the cost has gone too high and the threat is not as much. In these circumstances, then keeping it closed will become more and more difficult by the day. And if that's the case, then we very seriously need to think about what are simple, low cost, but very implementable SOPs that we can put in place. How much can we decentralize and allow people to adapt to local situations, and then provide them with the support that they need, and there's where budgets come in and other support comes in terms of decision making, risk taking, everything, so that they can do this effectively. Last thing I want to say at this stage, the system is not geared for most of that, Musharraf. The problem is, in private sector, we don't have good monitoring, etc. So there's not much we can do there. There's no regulatory frame. There's no eyes, so to say, or ears on the ground that we will have with low-fee private sector, especially, but all of private sector. In public school, the problem is the other way. We have never trained our people or expected that they will do local decision making, they'll take initiative, etc. So I don't know if the bureaucracies don't work that way anyway, but I don't know if the bureaucracy has the wherewithal to now suddenly say we'll decentralize in this manner. We will also support them and take the risk of making mistakes also. I think there are going to be many mistakes. There is going to be cost. Now, if a child gets sick, or God forbid, if a child dies, etc., are we going to hold that AEO accountable to the extreme that we usually do? For the 5 years or 10 years, wo show causes and cases ka hi jawab dega. Now, if that's the case, then of course nobody is going to take initiative or try to do local optimal decision making. So that's the problem I see now, that the system is so inflexible for one way or the other with private and public. It's very hard to see how these SOPs, whatever the SOP are, how they are going to get implemented. Maybe I can stop there.
Well, we'll definitely come back, Dr. Bari. I think, look, so Aurangzeb, Badini Saab, thank you for being so patient. Before you say anything, what I wanted to say was, my sense is that I think the first 2 months of the coronavirus or the COVID-19 sort of pandemic have pushed the system in a direction of more responsiveness. Now, I don't think that reform per se has taken place, but I do think that there have been certain very specific things that the system has learned how to do. The most important of them is coordination between the national, or rather federal, the provincial, and the local. And one of the reasons I was certainly very excited to have Aurangzeb join us today was to give us, an actual eyes and ears version of how things have gone vis-a-vis the coordination and the reaction and the responding to crises. Of course, Balochistan, and particularly Quetta, where there was a real fear. You'll remember some of the scariest stories in the early days of the crisis and the pandemic came from Quetta. There was one instance where doctors got into a scuffle. There wasn't enough PPE, but all of those problems seem to have been resolved. And my conversations with friends in Quetta now suggest that the number of positive cases is a trickle. Aurangzeb, do you want to just talk us through, first of all, just an update on where Balochistan and particularly where Quetta is, and then maybe address the very legitimate and I think reasonable concerns that Dr. Razzaque, Mehnaz, Akbar, Aziz, and Dr. Bari have in terms of our preparation at the local level? And you'll have to unmute before you start.
Am I audible?
Absolutely. Bismillah.
Of course. Thank you very much. Well, let me first apprise you about the present situation in Balochistan. Within the last 6 days, we have seen an increase in number of COVID cases from 0.5 to 6. And this is likely going to increase further. With the arrival of Muharram, the increasing in number of processions, the majalis, the number is likely to increase further. Yes, we learned something, and that is coordination within the last couple of months. But I believe that we are not yet very much prepared for many things. But the situation is likely to improve. I feel like that. Probably we are starting to learn. We have started learning to live with this COVID type of thing. As far as the schools are concerned, in Balochistan, we have got around 140 colleges and around 15,000 schools. On 15th of September, the government has directed us to open these schools and colleges. and SOPs have been communicated to us, and these SOPs have been communicated further to the schools and their staff. Training sessions have been Am I audible? Am I audible?
Yes, I can hear you loud and clear.
Yeah. Exactly. Thank you very much. Thank you very much. But of course, there would be certain issues. For example, we've got first of all the capacity issues, whether the school, the staff, the administration, they would be able to cope up with this COVID type of situation. Are they able to keep their children away from, merging with each other? And then we've got transportation issues, whether how these students would be brought to the schools and colleges. How would we provide the equipment, and who's going to provide them with the equipment, and who's going to pay for that? Then we've got private schools, then low-cost private school, the government school. Their capacity is again an issue. I don't know whether they're going to execute these things on ground or not. But yet we are trying to teach them. We are trying to make them learn that now we have to live with this disease. So let's see how we are going to do that. But to be specific, with increasing number of cases, I believe that dealing with the children at schools would be an issue. In one of the class, the directions have been given that you are going to have 20 children at a time in a class. The issue is that if at all we have got 20 students at a time, we would be having 3 shifts in a school. How is going to school is going to manage with these shifts? The last shift is going to end up at 7 p.m. To be, practical, would I be able to send my children when they are going to come back at 7 p.m. or not? Then we have got certain issues of equipment. The thermal guns have to be provided. Someone has to check the children. Who's going to provide these thermal guns, and who's going to pay for that? So the finances is an issue. The capacity is an issue, and our staff is untrained. Our schools, I am not quite sure that how are the low-cost private schools going to deal with that. The government schools, they do not have basic facilities. If you do not have basic facilities and you tell your staff to manage the kids, there are 20 kids at a time in a school, in a class, and then have 3 shifts, let me tell you, the teachers have got lives, the principals have got lives. They are important to us. It's not only the children. So we have been directed to cope up with that. How we are going to cope up with that, that's again an issue. But we are working upon it. Hopefully, we would find out a solution as we are going to live with this COVID. But here, the experts have to come ahead. They have to guide us that how to go about it, and hopefully, we'll do something. Though there are certain questions.
That's really a very helpful overview. Of course, the one thing that I was hoping for was some sort of reassurance that things are under control. But I think it's really important to be clear and candid on these issues. I think on the monetary part, we did a very small and limited simulation, Dr. Bari. I'll come back to you and then go to Ayesha. But just a quick reaction from you, Dr. Bari, on cost. For many years, you've been researching and writing about the management of school at the local level and the participation of parents and teachers in the community in running the school. And one of the school-based budgets idea and many other associated ideas have not had the kind of responsiveness that perhaps we would have liked. Maybe the pandemic and what I suspect will be reasonably chaotic first few weeks after the reopening. But maybe all of this will help us understand that school management can't be run out of provincial capitals or even a national capital. And ultimately, some much more robust degree of ownership and participation of communities in school management needs to be assured. Is that something that makes you hopeful, or do you think it's too much of a pipe dream? Dr. Bari?
Jeff, I hope so, but I also get the feeling that that's not what the government is right now thinking about. They're not thinking. So right now, whatever I see as happening is moves towards further centralization, not decentralization. And this is at various levels. It's not just related to COVID. There's a COVID-related issue here, but there's a non-COVID related. Non-COVID is the single national curriculum set. We'll have a conversation on that another time and so on. But even the use of technology, a number of other things have centralized many things a lot more. Right? All our monitoring systems, all our accountability systems, teacher management, a lot of those things are very, very central and continue to be so. Decentralization hasn't happened at that level, and definitely not at the level of how a school can respond to challenges like this one. As I said, you go to schools, again and again, you talk to people, they are still living in a world where keeping broken furniture is important because there's going to be an audit at the end of the year. So one room is locked up with broken furniture, and the children are sitting outside because the broken furniture, each leg of a chair has to be accounted for to the central office, not just to local offices and so on, right? And the computers are not used because wo kharab ho jayenge, or books are not used because people, children don't care how to use books. I mean, they are for them, but yet our systems are geared for a very different right. To expect in COVID, you will take the risk and you will say, okay, decentralize, and if there is a school that messes up, we will back them in saying, this is an honest mistake, and mistakes are going to happen. We have seen this in the rest of the world, right? There have been universities and schools that were opened up where there were cases and they had to shut down. There was cost in terms of not only ill people, children and teachers, but also that illness becoming very serious for many of them, right? It's a myth that teachers and young people are immune to this disease. They are not immune to this disease. And you've had long-term impact on health that has been recorded as well, both in children and other in young adults as well. Now the question is, is anyone going to give people that confidence and that protection? I'll finish with just one example, which I've heard. It was a few years ago that we added in Punjab the idea of a NSB, the non-salary budget that is given to schools directly, so that they can do their normal maintenance and some other expenses. And this is at the discretion of the principal with the help of obviously the local committee, and it's approved by the AEO. The plan is approved and then they can do the expenses according to the plan. Many years down the road, we are still trying to figure out how to get each principal and head teacher to use that fully and to use it well, right? This is about money, and it's not even much money. It's like 40,000-50,000 for a primary school. Of course, it rises for high school, but high school has different resources. So if you have that kind of a time frame in mind, then thinking that, okay, come 15th September, we'll have very empowered local administration, schools, principals, and parents. That's a very tall order to ask for.
No, I agree. Dr. Razzaque, one of the simulations we did was on hand soap. And what we did was we tried to estimate to the best degree possible, what would be the cost of, first of all, how many bars of soap do you need? And we did the simulation on 4 different schools, one each from each of the provinces. We chose the schools randomly. And these are all public schools. As you know, as you rightly said, 50 million kids, about half go to government schools. So we're looking at roughly 24 to 26 million kids that attend government schools. If each child has a per month cost of about, let's say about 30 rupees per child in terms of how much soap is required, which is kind of a lower side estimate. We're looking at 480 million rupees per month in soap expenditure. And I think that it goes to the point that was being made earlier about the scale of this country. I think because we are all experts on everything, thank God, we speak with such confidence about the specific instances where we've heard this thing. We often forget that there are many, many such things. And in this case, 24 million such things going just to the government schools. To what extent do you think this is an opportunity, Dr. Razzaque? And this is really what I wanted to use the rest of the conversation to do was really to explore with you and the other participants whether or not September 15th will come and go. There will be mini crises galore. There'll be scandals. There'll be hopefully nothing too sad in terms of bad news, but there will be a lot of noise. And you know, I think Mehnaz, Akbar, Aziz, and other members of the PMLN will take their piece of flesh, and for good reason. Obviously, it's the job of political opposition to call out what's not working. But for serious folks that are interested in reform, I almost feel like maybe in anticipation of September 15th, the thing we need to start doing is exploring a bunch of questions around education that, for example, you and Bari Saab and Mehnaz and others in the conversation today are invested in, with or without COVID-19. Dr. Razzaque?
So, Musharraf, so let me start here. So when the school closures happened, and when you, by the way, when you introduced DC Saab, I was actually in Quetta the day the school closing was notified. I don't remember the date in March, but I was there for some work with the education department, and they received this notification that the schools are closing for tomorrow for at least the next 15 days. And I also had a conversation with DC Saab, which he may not remember, but I do. When the pandemic, in my very first article I wrote the very next morning when I saw this notification about the school closing, and whether it's a good decision based on what we know about pandemics and school closings, and whether they are helpful or they're more detrimental than they are helpful, etc., etc. But to be very honest, when this thing started, and like you rightly pointed out, I mean, a lot of people have talked about, whether we can see opportunity in adversity. Yes, we know that we were not quite there. We were not quite ready to deal with a situation like this. But in the past 5 months, have we been able to do anything, or even tried to do anything that can suggest or give us hope that we have started thinking differently? Or a line here that I remember from earthquake ke baad, when the rehabilitation started, what the rehabilitation and recovery documents, there was a slogan that was used and is still used: build back and build back better. तो वो चीज़ इसके ऊपर भी अप्लाई होती है कि we knew that we already had gaps. बच्चे जो स्कूल में थे, at least 27%, 28% were out of school. Learning wasn't happening like it should happen when a child goes to school. वो सारी चीज़ें अपनी जगह. But have we been able to do things differently, at least start planning differently, so that whether school opening happens in September or next year, like Dr. Faisal Bari said, we'll be close to being ready for it. Unfortunately, over the past 5 months, there's no indication, at least the places that I've worked with, and I've worked largely in the public sector, there's no indication that has happened. हमने वही किया है that we are, what we are good at doing, which is firefighting. हमने उससे पहले भी firefighting की. We have done firefighting over the past 5 months. All we could think about was continuity of education, when we knew very well that we were not ready for it. At least, the large spectrum of schools that we deal with were not ready for it. लेकिन हमने उसमें फिर भी time और पैसा ज़ाया किया. हमने ये नहीं सोचा कि when the schools open, maybe what is more important is preparedness for that. और उसमें जैसे मैंने like I pointed out before, there's no reflection for that in the budget. यही चीजें देखनी होती है ना, अपने indicators और क्या होते हैं. It's not hearsay or it's not anecdotes or what the politicians are saying. It's what is there, tangible evidence that shows you that things are going to happen differently now. So there's no reflection in the budget. The schools, जैसे आपने कहा, soap तक अगर खरीदेंगे तो सिर्फ soap तक खरीदने के पैसे नहीं होंगे उनके पास every month. Did we even try and provide facilities, sanitation, running water, clean toilets, prerequisites to deal with a situation like this? Did we do anything? जो हम कहते हैं कि we're only left with 2%, 3% in every province where we lack these facilities. Have we been able to bridge those gaps? अगर वो वाकई सिर्फ 2 से 3% ही थे, has not done anything of that sort. So I mean, I understand that, you know, we have to leave this conversation at a positive note, and what can be done to, you know, आगे क्या हम कर सकते हैं that we haven't done before. But the thing is that there's no indication of that happening. Or I think I'll end with one point. Dr. Bari said something about, you know, writing off the entire year, and that, you know, at least one other country has done that. And will that matter to us? Dr. Bari, it will matter to the, you know, children who go to elite schools, who are going to be, you know, competing for seats in universities abroad, elite universities. So it's going to matter to those parents and those children, because those children are not competing with their peers in the country, they're competing with people elsewhere. लेकिन क्या public स्कूलों and low income private स्कूलों को does it really matter? And the politically incorrect, but the truth is that it won't. क्योंकि जैसे हमने पहले कहा, ये बच्चे already स्कूल नहीं जा रहे थे, और जो स्कूल जा भी रहे थे वो क्या पढ़ रहे थे. So that is one thing. And I think the other thing is the difference in philosophy of countries that started reopening schools. So whether they were, you know, capable enough of doing that or not, the scale of the problem, that's one side of it, right? But the other side is the more philosophical one, where at least we know that in a big number of these countries that started reopening as early as 2 months into the pandemic, there's a philosophical difference, which is that right to or access to quality education is the basic right of everyone. So in that case, some of them opened despite the fact that they were not certain about how it's going to impact the health of their children. So they opened and they closed again, then they opened again. जहाँ तक हमारा ताल्लुक है, philosophically speaking, these things do not matter to the government or to the politicians or even the bureaucracy to some extent. What matters is basically, you know, whether the private school associations are putting that pressure or not, or ab wo time aa gaya that everything else has opened up. So now you just have to start talking about opening schools. So that's my response to your question, Musharraf. I know I've not touched on the cost issue, but the thing is that I've already told you there's no reflection of that on any side to be able to make a concrete comment around it.
Dr. Razzaque, no, I think that's again, I think it's useful. It isn't ideally certainly what I want to hear. I mean, my bias here is if it's not obvious, I'm really keen for us to be able to find something that engenders some confidence that we know what we're doing. Everything that I've seen from the NCOC suggests that the degree of data pickup and processing and analysis is of a nature that we haven't seen before in this country. And so for me, at least, I'm interested in exploring the degree to which we can transfer that and make it a normal part of how we think of and look at education. But you're right. The conversation hasn't graduated. I think, Mehnaz, one of the questions I wanted to ask you, and I know you have comments on some other aspects as well, but also one clear opportunity that this created was for us to agitate around the degree of the digital divide in this country, because clearly a lot of kids and a lot of families that can afford it will be able to not just afford the high fees of a school, but also know that whilst the kids are home, they can access learning opportunities via the internet, via 4G, via their tablets, via a whole slew of, and it's not just the hardware, but also the software that, there is some work that's being done through ed tech companies. And to some extent, of course, the government has made an effort, the Delhi school and the Talim Ghar sort of applications, if you will, are certainly efforts in exactly the right direction. They came about in a really quick and short period of time. Again, I think we can legitimately critique how learning friendly they were, whether or not assessments are a part of the equation. There's lots of questions we can ask and raise about that. But as we wait for Mehnaz to get back online, Ayesha, it looks like you had something that you wanted to say. Dr. Razzaque.
No, I was actually just listening to your conversation. I think somebody is coming back up.
Yeah, there you go. Mehnaz is back. So go ahead, Mehnaz. Floor is yours.
Yeah, I would like to comment on the condition of education and what we did in these, building up on what Ayesha was saying. And, it's very difficult to lie. Not be just because I'm in the opposition, but also somebody, as someone who has dedicated my last 20 years in education sector, total complacency. ऐसे लगता ही नहीं है कि कोई, first of all, it doesn't seem that we have a corona emergency, pandemic, and वो तो खैर poverty, मतलब you can relate it to anything else as well. But talking about schools, we had plenty of time between in the last 5 or 6 months to think about issues like local governance, because these we cannot run things from the provinces or the federal when things have been devolved, but going down to the district and sub-district level, as Dr. Bari had said, the quality, just announcing one curriculum which will not see the light of the day, I can predict that very clearly today, is not quality of education. And finances, it was just so disheartening to see, and the commitment, the political commitment to creating better educational opportunities is missing totally. It's just totally firefighting. They would take the mic and respond to that, and it can't work. Pakistan is huge, 5th largest country in the world now, and the way we are dealing with education, it's shocking. We need to and we need to voice it. And I'm really glad, Musharraf, that you did this this panel today, because I think not many people are talking about education and their children's losses. Everything is being privatized. In the last 2 years, the government is very convenient to see health and education slipping into privatization, and not just the high cost, but the low cost as well. And what are we doing for the low cost private schools? So we have to look at the scenario and continue to raise our voices everywhere that we are, and nudge the government. Otherwise, by the end of the 5th year, it's going to be a total big disaster, which we will not be able to undo.
Mehnaz, maybe so again, it's a very weird spot for me to be in, to try and defend this government. It's not something I'm accustomed to doing, but I do think that and I know you've had some exposure, I'm sure, to tele school and Talim Ghar, the Punjab effort, and the federal government effort. Any comments about what that indicates? I mean, surely there's at least an indication there that there was an effort to respond to the crisis, or do you believe that it was an effort entirely in vain? Mehnaz, did you hear the question, Mehnaz? Yeah, I think we've lost Mehnaz. Faisal, maybe can I ask you, Dr. Bari, to respond to that instead? Is it really true that the government has done nothing and it's just it's a total black hole?
I think दो तीन चीजें हैं. We need to keep in mind that this is a very different kind of crisis we have had than previous crises. In the sense people talk about the floods and the earthquake, here's a crisis that is not that didn't end in the 5 days, 10 days. In the case of the quake, it was just a few seconds that changed the situation completely, and then it was rehab and reconstruction. Here's a crisis that is continuing, and we just weren't. And nobody was, but we were also not prepared. And that our government and our society is at a stage where preparation like this is very difficult anyway. So I'm not surprised by the government response. I think what they did, what they have tried to do, and what they have done is maybe all they could do quickly. But the problem is much more deeper and I think longer term than this. And that is that we have never given the attention to health and education that we should have as a country. And this is not something that I'm saying today. It's William Easterly wrote about the human development gap compared to our GDP with comparator countries in the 1980s, if I remember correctly, right? And he said that there's been a gap consistently for Pakistan, and we've underinvested, underspent, etc. Even though we have a very young population, we have a very large 5 to 16-year-old number of people, and so on. So those problems have become compounded every year and with every government. So it's not an issue of this government or that government. I mean, this government found itself in a very difficult position. It tried a few things, and it is still trying to do things. I know that they're trying to review the SOPs so that they can reduce the SLOs, so that when the children come back, it's not a regular year. We try to estimate what they have lost, and then we go on and just do the important SLOs for this year. So there's a review of curriculum, there's a review of what chapters to include, what not. There is that TV, etc., that has come in. Internet, I mean, as a university, we are having, and one of the more elite universities in Pakistan at LUMS, we are having problem with internet, not just in far-flung areas and areas where there's no internet, but even sometimes in cities as well. To expect that for 50,000 or 100,000 or 200,000 schools, and with children with very challenging circumstances, it is, from an economic perspective, is just impossible. I don't think we can do it in 5 months or so. We have to really think other things here. And last but not least, also the home environments, right? I was never fully conscious of this argument, but now I'm very aware of this, that the university or a school space is a lovely democratic space as well, Musharraf, in the sense that when a child or a young adult comes into a university, it doesn't matter what kind of a household they are coming from. They have equal access to teachers, libraries, other things, etc., etc. They can speak in the same way, they can be in the same way. And similarly, to a certain extent, the school as well, right? Our children are coming from very varied backgrounds. A lot of my students in the university say, I don't have a device that is just for me. I don't have a quiet corner in the house. I don't have a room to my own. This is why I was coming to the university anyway to study. And now, if with that space taken away, how do you do education, right? So you talked about the digital divide. This COVID is actually going to expand all of these divides, not just because of digital, but home environments, learning abilities, how many books there are at home, whether there are, how many siblings do you have? I mean, I have students who are married and have young children, and they say my classes are happening at the same time as my children. So what are we supposed to do, right? So all of those issues come in, and to deal with that in 5-6 months is difficult. What I'm hoping, though, is that we will be able to have a much deeper look at our systems and start systematically moving towards addressing them. And that has been the main problem with education and health. If you'll just give me 1 more minute, I do want to say that I think our government has traditionally been very good at mounting either emergency relief or doing SOP-driven things. But it has been terribly bad at managing areas, and this falls largely in service delivery, where human agency is involved, agency of a health provider, agency of a teacher and a principal. How do you incentivize them and create that career path and the entire career structure for them so that they deliver optimally on what we want them to deliver? We have been very bad at that. And I think that is what is continuing to hurt us even today, and will do so. I have a feeling if we don't go deeper even now.
I think that really is the big fear. My big fear in this conversation is that we would have to end the conversation on a note of realism, which obviously entails accepting the very substantial challenge before us. Before we close off, with due apologies, I don't think we've been able to reconnect with either Aurangzeb Badini or with Nadya Karim Shah. Is Aurangzeb with us?
Okay,
so now
yeah, I'm with you.
Oh, so I didn't realize that, Aurangzeb. We can't see you anymore, but I think maybe we'll leave the last word to you, given that you're in Quetta and we can't see you, and we pretended that you weren't here. So thank you for bearing with us, and apologies for whatever technical difficulties have caused uh, this blacking out of your screen. But we won't black out your voice. Tell us, Aurangzeb, is there any reason for us to be optimistic about how things are going to go starting September 15th?
Yes, I believe that when we started off with the COVID, we were not quite aware of it. That how are we going to do with that, and we didn't know that what it really is. But finally, we tried, and we finally managed something, if not good. So I believe that if at all we carry out regular consultations with experts, and then we have got regular trainings of the staffs, the finances are being provided. I believe we would be able to cope up with that, as we are dealing with it at nationwide. The schools would open. There is no other alternative, and if you do it in a better manner, I believe we would be able to, resume with our educational activities. If at all we do not do that, we are going to miss this whole year for our kids. So let's see, we do better. Uh, we are striving hard, but of course there will be certain challenges. But I'm quite optimistic there, that we are going to deal with it in a good manner. Thank you.
Well, Aurangzeb, let me ask you this question because, even in regular times, one of the complaints that people like me and I suspect some of the other friends here have is that, DC's, their attention is so divided. There's political pressures. There's every major crisis that DC and his team of ACs have to handle. Uh, then there's the law and order and coordination with the chief secretary and all sorts of things. And so the ability of an AEO or a DO or basically anybody within the system, a school principal, a high school principal, their ability to access a DC to get a problem solved is compromised to begin with. Now with COVID-19, obviously the district commissioners are even busier. Is there a mechanism that you have thought of, or within the SOPs, are there measures that are being taken to make sure that, especially for the first few weeks, since we're going back to school after so long, that there's a special provision that allows schools to have access to the assistant commissioners and the DCs? How will the local administration tackle the education challenge as schools reopen?
Well, there is already a mechanism in place. There is a district education committee, and it's being headed by the deputy commissioner, with, of course, the district education officers and other officers in place. But the main responsibility would be, of course, of the education department, the director education, the DG education, and of course, district education officer within the district. They are going to overall manage all these things. As far as the supervision is concerned, of course, the deputy commissioner and staff would always be available, and we are hands in glove with each other. I don't think that there will be an issue if at all we start off with the schools, and hopefully they won't have the issues, the fears which you have, and hopefully things will be better on ground. And I guess that we won't be having certain issues, and we are going to do it and manage it in a befitting manner.
Last question, Badini Saab. Thank you for being patient. One of the things that the NCOC helped overcome was the absence of data from the hospitals. When things got really bad towards the end of May and immediately after Eid, one of the reasons was that the data that was coming in from the hospitals and from the local level wasn't coming in accurately and wasn't coming in fast enough. Has the NCOC indicated to you or to the provincial government any kind of a mechanism to ensure that, the challenge that you had at the hospitals won't be repeated at the schools, that you'll be able to get quick data from every school in each jurisdiction? Is that an issue of concern, or do you think it's already been dealt with and catered for?
Data is not the only issue which we come across. And we have got this issue almost in every sphere, not only in COVID. And as far as the NCOC is concerned, yes, we have got another institution or department, that is provincial COC, that's Coordination Center, that is already available and in place. Now we will have less chances of data being misplaced. And hopefully with the passage of time, the mechanism would improve further, and we are going to have more better or accurate data in future. And I'm quite optimistic about it.
Well, I finally got the optimism that I was looking for. So for that,
Well,
DC
as a
Saab,
government official, I have to do that.
thank God. Mehnaz, Akbar, Aziz, Dr. Ayesha, Razzaque, Dr. Faisal, Bari, Aurangzeb, Badini Saab, thank you, all four of you. My apologies to Nadya. She wasn't able to join us. If any of you had any parting thoughts, positive or negative, realistic or optimistic, I'd be very happy for us to share them with our viewers before we sign out. Mehnaz?
We just need to reclaim the space for education. We need to bring it back into the forefront. It's gone to the backstage, and it's not acceptable.
We have a live sort of stream of comments on YouTube, and at least one friend who's been very active is aghast that there's no time for Q&As. So if you don't mind, I will go through this and share a couple of either comments or questions, if that's okay with our panel. So YNR asks, why not have a hybrid system whereby only necessary hands-on work should be done in schools until vaccine, which is 2 to 3 months away? Who wants to? Dr. Razzaque, why don't you take that one?
Musharraf, can you repeat the first part? I caught the second part, but not the first.
Why not have a hybrid system whereby only necessary hands-on work should be done in the schools until the vaccine, which is only 2 to 3 months away?
Okay, I mean, I don't know whether the vaccine is 2 to 3 months away or more than that. So some countries we know are experimenting with that, right? So, for instance, schools, especially the elite private schools in Saudi Arabia, for example, have already said that the next 4 months will happen online. They have yet to figure out, whether they have to bring in senior students to do any practical hands-on laboratory work or not. But they've largely decided, just because, they have that kind of infrastructure and that kind of access available to all of their, all their students. In Pakistan, yes, it can happen, but it can happen for that very small segment where this, online education, like we said before, or distance education is not an issue, because, your schools have access to 3G, 4G, your teachers have access to it, your children have the necessary equipment, hardware and software at home to be able to manage something like this. And I'm not sure if any of the elite schools in Pakistan will go that route, but that certainly is a possibility, but for a very tiny segment of the school population that we're talking about.
Thanks, Dr. Razzaque. Next question, Dr. Bari, perhaps you could take this. This is also from Yasir Nawaz Raja, and the question is, why have not schools worked on a proper online teaching policy for COVID-19? Other emergencies might produce a similar sort of set of challenges. So why don't we have online teaching policy in Pakistan? Dr. Bari?
I think Ayesha gave a part of the answer. The elite schools can definitely do that, because their students can afford to pay extra for online things. They also have access to devices. They also have a home environment in which they can actually sit in that home environment and still engage with a good online system. But for the majority of our children who go to low-fee private schools and to government schools, their homes don't have that kind of devices. They don't have access to internet, and even that hardware issue is. Over time, we can probably try to resolve it, but that's a massive amount of investment that is needed, both to give hardware, tablets, phones, computers, and software in terms of Wi-Fi access, internet access, and so on. But even if you do that, for most children, they will not be able, their home environment is not such that they have to take care of younger siblings. They have to sometimes work. They have to, they don't have a quiet space. They don't have a quiet corner for themselves and so on. So it will not be easy for them to study, even if we are able to solve the hardware software problem. So, I mean, an internet-based or online education system for the entire country is very, very hard to foresee right now. And we have to ask the question that, is that the kind of investment we want to make? Because it will require a huge investment. So going forward, is that the investment we want to make? Or do we think that eventually we'll get used to get some way of dealing with COVID, and therefore the investment has to go somewhere else in terms of much higher quality education in schools, etc., etc. So do you prepare for this contingency and go that route, or do you actually think about how do you want to make education better? Remember, in this entire conversation, so last minute, in this entire conversation, we have not at all talked about the 20 million children that were not in schools when this hit, COVID hit, 20 million or whatever, plus minus, the 5 to 16-year-olds that are out of school. And there is no talk yet of those children, even post-COVID. So we are only talking about those who were in school. So the question really is, okay, do you want to invest for them, or do you want to actually put the investments in making an online system?
Musharraf, is it okay if I very quickly follow up on what Dr. Bari just said? Dr. Bari, I completely agree. I think, coming up with a policy and then an implementation plan and the funding that is, good enough to go with it for a digital policy we're still a very long way from it. But what I felt would happen, what I thought initially would happen in these 5 months is that at least, the school departments will start thinking, by the end of this period, will not be as averse to using technology as they were before COVID hit, right? But very surprisingly, and because I've spoken with a couple of department secretaries, that change, that shift has not happened, at the top level or at the, the levels below the secretary level. So that change has just not happened. They've actually, some of them have, said that, oh, my children go to these very good, what you call elite private schools, but even they are having technology issues when they do their online education during COVID. So unfortunately, some of the things that we thought that the departments or, the education system will start thinking differently about, that shift hasn't happened. They have now come to, so television screens are okay, because I guess that is something that we are more comfortable with and feel like it's a broadcast scenario where direct transmission or that you don't have to worry about those issues. So they have come to that point, but they're still very far from acknowledging that the next thing that systems at least should start thinking about or strategizing for over the short, medium, and long term is a digital policy. And by the way, the the comment about the out-of-school children, I mean, that was the 22 million, depends on what reference you go by, was the figure of out-of-school children before COVID hit. But I mean, there's fear, and a lot of different think tanks and studies from around the world are suggesting that there will be an even bigger dropout once schools open, because some students who were already at the risk of dropping out will drop out after this large absence from school. So even to bring some of those children back, technology will be important. I won't go into those details, but I think technology, we need to start thinking about that shift, along with making sure that what's happening at school is of quality.
Thank you, Dr. Razzaque. I think that sort of, that's exactly right. And it's clear that the conversation needs to continue, but I'm grateful to you, Dr. Ayesha Razzaque, Dr. Faisal Bari, Mehnaz, Akbar, Aziz, Nadya, Karim, Shah for at least making an effort to be part of the conversation, and the DC for Quetta, Aurangzeb, Badini. Thanks also to all the viewers, especially those that shared comments and questions online. We'll continue the conversation, and we'll continue the policy roundtables very, very soon. Thanks once again for joining us. Khuda Hafiz.